Respiratory failure, acute respiratory distress syndrome, which is also called, basically what it is, simple. Insufficient exchange of oxygen and carbon dioxide in the lungs. What happens when you have ARDS? You will have shortness of breath, which is called hypoxemia. You will have dyspnea, which is called difficulty breathing. And you will have something called hyperpnea, which is increased depth and rate of breathing. Okay. You will also have edema. This edema is not cardiac related. And you will have pulmonary infiltrates, which is pus, mucus, or blood in your lungs. You will have abnormal lung sounds when you auscultate with a stethoscope. And what causes respiratory failure? Anything lung related, basically. You will have, if you have COPD, and COPD happens when you smoke cigarettes, cigars, hookah, marijuana, you have COPD. Pneumonia, tuberculosis, TB. If you have an aspiration, you have an emboli. If it goes from anywhere from your body, you have a drug overdose, you have a respiratory failure, you have a fluid overdose, you have respiratory failure, shock, and DIC. How would you assess a patient with respiratory failure? Simple. You assess their lung sounds, and you will hear rales or crackles. You will see intercostal retractions, because you will see all the intercostal retractions. The person will be blue, and he will be anxious and restless. How would you diagnose respiratory failure? Impaired gas exchange, risk for deficient fluid volume, ineffective breathing, risk for infection, and risk for risk for injury. Plan. How would you plan for this patient? You position the client first, a 95-degree angle to 45-degree angle. Monitor for hypoxemia, and monitor his O2 toxicity, vital signs. You monitor cardiac functions. You monitor ABGs, level of consciousness, and urine output. So, simple. This is all there is to respiratory failure. Ineffective gas exchange of O2, CO2 in the lungs, shortness of breath, hypoxemia, hyperpnea, dyspnea, edema, and pulmonary infiltrates. Abnormal lung sounds. What happens? What causes respiratory failure? COPD, pneumonia, TB, aspiration, emboli, drug overdose, fluid overdose, shock, DIC. How do you assess? Lung sounds, intercostal retractions, cyanosis, which is person is blue, and anxiety, restlessness. Diagnosis: impaired gas exchange is the major one. Risk for deficient fluid volume, ineffective breathing, risk for injury. Planning: position client, monitor vital signs, cardiac monitor, ABG, level of consciousness, and monitor for hypoxemia and urine output. Urine output is for renal function. And that's it. That's all there is to respiratory failure. All right.